and welcome to Askimo TV. We're here today with Graham Price, who's a multidisciplinary therapist, a coach and a trainer. And Graham, I'd like to ask you to tell me a little bit about cognitive behavioral therapy and what it is.
Yes, cognitive behavioral therapy, CBT for short, is what we call an intervention-based therapy. It's what makes it very different from other therapies like person-centered counseling or psychodynamic therapy. CBT is, as I say, it's intervention-based. So in other words, it has a bunch of tools that we can apply in helping people to change the way they think and behave. It's called cognitive behavioral therapy because it focuses on cognitions, which is a fancy word for thoughts, and behaviors. And it recognizes that there are some very clear links between the way we think and the way we behave, and indeed the way we feel. So CBT recognizes that the way we think, behave, and feel are closely related, and it aims, because we can't do anything directly about the way people feel other than with drugs and maybe some relaxation techniques. Generally, we can only play with the way people think and the way they behave, and that's what CBT attempts to do.
Mm-hmm. And so what kind of things can CBT help with?
Well, it's very, very broad. Particularly, it's very broad if it's combined with more modern approaches that are called acceptance-based approaches. CBT alone has been, the effectiveness has been widely researched, and indeed it's highly accredited for two of the most common emotional problems, which are anxiety and depression. So in Britain, for example, NICE, which is the National Institute for Clinical Excellence, has come out strongly in favor of CBT for the treatment of anxiety and depression, and that's based on all the research results and studies that have been done. Combine CBT with acceptance-based approaches, it becomes effective for a much wider range of issues. And in fact, practically any emotional or what we call emotional behavioral issues. So emotional issues would be like things like anxiety and depression. Emotional behavioral issues would be things like eating disorders, OCD, that sort of thing. CBT combined with an acceptance-based approach, like, for example, acceptance action therapy, would be highly effective for the whole range of emotional and emotional behavioral issues.
Okay. I'm wondering if you can break down a patient's experience of CBT, what it would involve, what kind of methodology it is.
Yeah, well, let's take anxiety, for instance. That's something that CBT deals with fairly easily. Anxiety comes in all sorts of forms. For instance, things like phobias or panic attacks or post-traumatic stress disorder, or just general anxiety, which means people are anxious a lot for no apparent reason. And CBT would address the thoughts that may be happening that are driving that anxiety. So some anxieties are very easy to see the way people are thinking. So, for instance, if you've got a phobia, then you're thinking that whatever it is you've got a phobia about is somehow dangerous or threatening. If you're suffering from panic attacks, then we know that the thoughts that drive them are fear of panic itself. And then CBT would look at the behaviors that are going on when people suffer from anxieties. In the case of anxiety, that's always about avoidance or escape. So we would look at the avoidance and escape behaviors that people have and try and change them. Because one of the ways anxiety is perpetuated is by avoiding the things that make us anxious. Now, if you add acceptance-based therapy to that, then you've now got a way of dealing with people's feelings as well, because we train people to accept their feelings. So learning to accept anxiety is a powerful addition to the approaches that CBT takes. So
okay.
that would be the treatment.
And once I've embarked on a course of therapy, how quickly might I see improvement?
Pretty quickly, actually. It depends what the problem is. Anxiety, for instance, is the easiest thing to treat with CBT, and with the addition of an acceptance-based approach, such as acceptance action therapy, it's very quick. So, for instance, panic, providing we're using acceptance action therapy in addition to CBT, could normally be resolved in one session. So a single session would normally be the expectation of something like panic attacks, and maybe a second session just to review how it went, and that would be it. So that would be the easiest thing to resolve. Other anxieties, like phobias, general anxiety, PTSD, post-traumatic stress disorder, and that sort of thing, might take 3 or 4 sessions. Now, if you've something like mild to moderate depression or insomnia, for instance, which are both very common, 4 to 5 sessions would be normal, maybe 4 to 6 sessions. More difficult or challenging problems like OCD, eating disorders, addictions, that might take longer. So that could take 8, 9, 10 sessions to deal with CBT.
Okay, interesting. I think it seems like it's more targeted and perhaps more effective in a shorter amount of space than people might imagine.
Absolutely, yeah, and especially if you include an acceptance-based approach like acceptance action therapy, that speeds up the results quite dramatically. So yes, we have some powerful tools now. A combination of those two therapies is very powerful and can resolve problems quite quickly and also sustain those resolutions, which of course is very important.
Yeah. Okay, well, thank you very much, Graham. That's been a really good first introduction to CBT, cognitive behavioural therapy, and thank you for your time.
Good, it's been a pleasure.